for the procedure. Madam, if the Honorable Minister could bring to this Parliament a sample of the masks she's describing, so that we as people's representatives could inspect and see. Because we risk a situation where they are produced in millions and then a debate will begin that they are fake. And secondly, if the minister could tell us whether Uganda National Bureau of Standards is involved in determining those qualities of masks being made by NITIL. Because we have a situation where Ugandans doubt its government. The other time you issued fake condoms and people have resorted to using caveras in villages. So we need to be serious on these kind of things. Thank you.
Thank you, Right Honorable Speaker. And thank you, Minister. But I'm a bit confused, as the Honorable has stated, because the first directive was that in order to go to public, by 19th you must have a face mask. And as I talk now, my people in Rwanda and in Kabari are all being arrested because of that directive. And here, I am again shocked that actually that directive was given without technical specifications. Because if you knew you had not given technical specifications, and therefore the right masks will not be there, how do you now anticipate the public is going to think of what to do and then buy the right mask? I think this is very unfortunate. We should not come up with regulations which we are aware are not going to be implemented because of ABCD. We know we are in a state of emergency. We know there can be emergency procurement, but still within the law, certain steps must be taken in order for you to follow emergency procurements. Right Honorable Speaker, as we talk now,
Conclude.
yeah, let me conclude that even those specifications they have given, I don't think they even have reached the intended manufacturers so that they can put in their bid. Unless probably you also prove that.
Onamwijuke.
Right Honorable Speaker, about a week ago, we went for an oversight role in Ntungamo, Isinjiro, and then finally went to Buhweju. In all these three districts went to, 80% of the health workers did not have masks and gloves. 80%. We have 35,000 health workers in this country. We know their locations. They're in either public or private health centers, or even in mission facilities. If we are not able to take the masks up to now, Right Honorable Speaker, how can the minister really, a Catholic like myself, come and say, unless really he's unless asking her to come and just read a document which she doesn't believe in, how can you come and say in 2 weeks we shall do what we have failed to do with the health workers? In Buhweju, I had to make myself a purchasing officer and buy all these equipments for all the health workers in Buhweju and all the security personnel at the risk of being arrested and charged with attempted murder. So, Right Honorable Speaker, the point I'm making is, unless there is something that the minister knows and we don't know, I think this is not possible, and she needs to tell us the truth so that we help her. Thank you very much.
I'm wondering, when you look around, we are all putting on masks. And these masks are bought from the pharmacies. And we are also aware that most of these masks are imported. And all imported masks pass through the required tests by National Bureau of Standards. Now, where do you want the importers of these masks to put what they have already imported? That's one. Two, you've also said, from your own submissions and yesterday's directives from the President, will be effective from 26, when public transport will be open to the masses. But previously there was a directive that face masks must be mandatory by 19th, which was yesterday. Now, what contradiction? I seek clarification on that. I want to thank you, Madam Speaker.
Honorable Speaker, and thank you very much, Madam Minister. Last evening, when I listened to His Excellency the President giving directives, the issue of public transport and even private vehicles coming on the road was hinged to wearing of masks, which will be provided under his directive, and he indeed told us that it is Nightingale Ginger Fabrics which is going to manufacture these things. The question which I want to ask the Minister, through you, Right Honorable Speaker, is, if it has taken so long for government to pass the money which we appropriated here to the districts, to the RDCs, to the district health officers, how long will it take this same government to provide face masks for 42 million Ugandans? Because we are all looking to that time when we will all have it, so that public transport will open, so that other businesses will open, so that the public is allowed to move out freely as the President directed. How long will it take? If it has taken you so long just to wire money to the districts, how about the manufacturing and the distribution of these face masks? How long will it take you?
First of all, we need to know the burden, the load we are carrying. The masks that we are to wear, how many masks does any individual person need in a day? Do we use the same mask every day until the end of the lockdown? And when is the lockdown ending? For me, government, if we go by the statement presented by the Honourable Minister, government is not well prepared to handle this matter of the masks. Secondly, in my opinion, Honourable Speaker, this is a mass disease. This is a mass problem. It requires also a mass approach, where many people get involved at the same time. That is the only way we can beat the time deadline of maybe 2 weeks. Now, Honourable Speaker, we are talking about face masks made out of cotton, made from a factory. Now let me ask you this question. Why is the government not promoting the industries which are spread up outside Kampala? We have Pakwach Ginare, we have Rhino Ginare, we produce cotton there. Actually, I visited Rhino Ginare, and there is cotton inside that ginare. The ginare has been run down. The government should use this opportunity to pop up and make our industries to work so that we can respond to our own situation from West Nile to produce our own masks from there.
Speaker. Right Honourable Speaker, in the Speaker's statement, in the Minister's statement, I thought he's going to talk about the companies they talked about yesterday. Madam Speaker, State Minister for Health, Honorable Nabanja, told us that they were in a meeting with over 20 companies. I've not heard any company that has been mentioned. Madam Speaker, I wouldn't like or wouldn't expect the executive or the cabinet to disregard PPDA rules under the guise of COVID. Madam Speaker, as we try to boost and also to encourage locally produced goods, Madam Speaker, yesterday we were urging government to ensure that even our small companies, the groups, the ladies down there all over the country, because this is a very simple thing that can be made by many Ugandans and they can earn money out of it. But it seems like They want to only to ring fence a certain company for their own objective, Madam Speaker, and that is really very bad in as far as Bubu is concerned. Madam Speaker, when it comes to schools, I wonder how they are going to distribute masks to schools when we know that they are saying 1 mask per person. And Madam Speaker, some of us who are in schools, we cannot even give a student 1 pair of uniform because we know the repercussions. How can we say we are going to give only 1 piece, and in any case, if that piece is lost, definitely he's going to be in danger. I think, Madam Speaker, through the Minister of Education, they can distribute these masks through education institutions so that when schools open, they even get them from schools rather than from any other place, Madam Speaker.
That are going to supply the face masks to Ugandans. Therefore, I have a question to the minister, whether what the president called frontline districts have special masks, because the way we see how the National Task Force is handling COVID-19, we people on borders, we are really facing the challenges that all the markets are closed on borders. Right now, according to what the president said, after the lockdown has stopped, the border people are not supposed to move. I don't know whether we shall fly. I therefore need to know what is the government affirmative action on us people from the borders. And I want to use this the same time, Right Honorable Speaker, that in April, the Committee of Health closed the food produce markets in Busia. And as I talk right now, the cereals are rotting in the markets. For the business people, I have requested the government many times, even give us 3, 4, 5 days for the business people to remove their cereals so that they don't rot and begin growing. There is no an answer. Right Honorable Speaker, I really need your help. Lastly, I have a question to the minister. We had a Chinese billionaire called Jack Ma gave a donation of face masks that were rejected in most African countries. I really want Ugandan statement concerning the masks that came to Uganda. Where are those masks? And if they are here, are they not dangerous as what we heard from Tanzania? Because Tanzania rejected them and the other countries in Africa.
NITIL will be the one producing these masks. Assuming NITIL plus all other companies, the 20 Honorable Nabanja talked about, produce 12,000 masks every day. Assuming they worked 3 shifts producing these masks every day, that is 36,000. If you divide 36,000 by 42 million, you get 1,167 days. That is almost 3 years. Now, if you add on this lockdown every 21 days, 21 or 14 days, when shall we ever end? Honorable Moriko, please come very clear to us as to the timeline and whether this deadline of providing masks for every Ugandan will.
And my dear colleagues, Honorable Minister, Uganda has 1.4 million refugees currently. That is in Western Uganda, in West Nile, and other areas, in Rwamanje, in Koboko, Yumbe, Obongi, and so on. These refugees are both, we categorize them both as urban refugees and those who have settled in their areas amongst the community members. And it has been realized that at times, more often than not, these refugees sneak from their areas of settlement and go to their home countries for food, and especially the ones from Palorinya in Obongi district. And because of insecurity, they sneak from Sudan and they come at night and mix with the rest of the population who have settled. And this has really caused a lot of problems in the sense that it has become very difficult now for the RDCs to control the movement of these refugees. How will you be able to now give out face masks for these refugees who are always on the move. Thank you very much.
Thank you so much, Right Honorable Speaker. Right Honorable Speaker, I would like to request, first of all, to thank the government for not keeping a deaf ear over this issue of the great need of masks for the communities. My humble request is that this time round we need to learn from our past mistakes. Sometimes we come here with very good policies and ideas. Just at the stage of implementation, we spoil everything. As soon as we get these masks, or if we choose to give them out, I'm requesting that let's work with the local leaders, the LC1. These councils know their citizens, they know everybody. They can easily manage everything. I'll give an example of the distribution of food. Right Honorable Speaker, in some LCs, some citizens were left out simply because the local leaders were not involved. Even those that were they were not empowered enough, and they were not listened to. You find someone saying, because so-and-so is living in a beautiful house, these people are tenants. And sometimes you find two families sharing a house. That doesn't mean because they can afford to pay that house, they own it. Right Honorable Speaker, I request that this time round when they are issuing out masks, please, let them work with different local leaders, the youth leaders, the women leaders, the LC1 councils, and everybody. Thank you so much.
You know, I studied some little science and also do a lot of reading. I want the minister to clarify for us the quality of mask in terms of effectiveness in viral spread prevention. The one I'm putting on, the N95 the Honorable Bahat is putting on, and the one Nightingale is manufacturing, which the Honorable Mbwa is putting on. Science shows that these pure textile masks are not effective in protecting, so far the research done, in protecting people against the coronavirus, unless if there is a filter in between the cloth sheets.
After
sensitization from Honorable Shabe yesterday, I decided to come in with a local content of which I'm not certain if it is so effective. So, Right Honorable Speaker.
But thank you for supporting the ordinary producers.
Thank you. Right Honorable Speaker, my biggest concern is we are talking about masks being given to communities. But my biggest concern is, before thinking about the community, are health workers well catered for, the frontline health workers? When you move in constituencies, in our constituencies like Kasambia, there are no masks. The ministry has only concentrated in regional referrals where they are expecting maybe to put people who are suffering from COVID-19. But they've neglected all the health workers down there. So, Honorable Minister, we've seen people donating PPEs, so many. But where are they going? Whom are you keeping these masks for? Why shouldn't you first think about health workers? I thank you.
Today, she has said those who are able can go ahead and purchase the right standard. Which one should we follow? And if so, if you are saying the right standard, it is this time that you should tell the country which sample should we follow. And if we followed that sample, and you are directing the country to buy those who are able, why can't you drop that purchase as a government so that we can save those innumerable billions which we are likely to spend?
Right Honorable Speaker, procurement has been decentralized. A number of things are procured at the local governments. I want to find out why this time masks are being centralized when even at district levels we have DHOs who can guide districts to procure masks that can be used by local governments or by people within the districts. Two, I come from a border district. We still have porous borders, and some people have families across the border and they still cross. I don't know what government is planning to supply masks to those who are crossing from Kenya to Uganda. And finally, Honorable Speaker, I know Ugandans are very innovative. Why doesn't the government just declare that people must put on masks and people will be able to innovate and only give us standards?
We have all gone to school who are in this parliament. For a fact, by law, national medical stores is supposed to procure medicine and medical supplies. I've heard the minister saying that they have met somewhere in a group, they are looking at these masks and they have met the manufacturers. Really, is it procedure right, Honorable Speaker, for the minister to continue addressing us that actually they are doing some procurement of medical supplies?
They are purchasing officers.
Sorry?
They are purchasing officers.
Yes, that they are trying to purchase. Yes, the mandate lies with the national medical stores, who have also issued out a bid in that way. Is it procedure right, Honorable Speaker, that we allow the mandate of a government entity to be hosted by a certain group of people who don't even have capacity to verify the quality of these masks? Because to food, all food which has been supplied to government, it has been subjected to Uganda National Bureau of Standards, meaning that when the national medical stores raise the specifications, it is through bids and they do the specifications. Does the minister and the team how they are meeting have the competence to determine the type of mask as Pao is explaining? I seek your guidance, Madam Speaker.
Right Honourable Speaker, I did not intend to raise on this matter, but we are discussing a very important issue. The procedure I'm trying to raise, Madam Speaker, is the minister is trying her best to explain, because we are getting these masks under very complicated circumstances. Even if we use national medical stores, actually the process of medical stores would be even longer because there are a lot of procedures. Now, but the way we are trying to raise to the minister is like she should abandon that process and use national medical stores, which even will be longer. So I wanted just to raise a point of process that why can't we try to guide the minister and allow her try to preside over this matter? Because really, I think to do the best under the circumstances. But we are looking as if she's making a mistake. She's not. No, I'm a member of parliament and I must be able to speak. So I think we must always try to be a bit more, to understand the situation, because the minister is trying her best. National medical stores, as I know, cannot manage to handle this matter even the way you are talking about. So I would think that, Madam Right Honourable Speaker, let us guide the Right Honourable Minister to preside over this matter. Look at everyone who can be able to produce, even if it's national medical stores, but we should not go into those procedures of national medical stores, which will be even take longer. Yeah, that's what I want. I think we should be able to look at the situation. This is a very serious situation. We need these masks as urgent as possible, but also we must also be mindful that there are a lot of matters, a lot of issues, the procedure that we might not be able to follow. So I think let us have this understanding instead of trying to show the minister as if she has made a mistake.
Please take your seat.
Thank all my colleagues for the issues they have raised, their contributions, and some of the clarifications they have raised. I'm happy that the issue of the science of face mask was raised, which, Madam Speaker, I was starting with it. However, I am so happy to briefly just elaborate about the types of the mask. But allow me start saying that, Madam Speaker, we are living in a situation of pandemic. This is no longer the normal situation that we are in. That means whatever we do, whatever we discuss, we have to adapt and devise mechanisms to live within this pandemic. And that is why the phenomena of face mask has never been there traditionally. And that is why, Madam Speaker, I was bringing on the floor of Parliament the types of face masks we have specifically in this country. We've got the N5, which is basically the type that is used in isolation centers for removal of samples and for handling highly infectious conditions. We also have the surgical masks or the medical masks, which some of us are putting here, which is disposable, which you use, you don't need to reuse it now and then. It is used and thrown. We also have the type we're talking about, the cloth mask. The two types of mask traditionally have been used in a health situation by healthcare workers in the state of surgical operations. So the face surgical mask and N95 are basically traditionally used in a hospital situation. However, the surgical masks, as you've seen, very many people that are able to afford, they can put on. Even here right now, many of us are putting the surgical mask. Madam Speaker, these two types of masks, by and large, they are not produced from our country. They come out of Uganda. And I want to say that the President made this statement some times back. Already the arrangement to ensure that in the next coming month, these surgical masks should be able, we should produce them within Uganda. That is already the communication that was made by the President and the arrangement that is going on. The issue we are discussing, Madam, on this floor of Parliament specifically is about the cloth mask, which is the NITIL. And I was trying to, Madam Speaker, make a statement on this type of mask, the standard that is required, the double layer NITIL cloth that can be made with a filter inside that can allow, something to be filtered up to about 95% of particles. And one of my colleagues asked the science behind that. I think literatures have proven it. Very many scientists and professors in ICU and many other places have proven that these NITILs, when they are double layers filtered inside, they are able to filter particles. Madam Speaker, having said that, allow me to say this. I made it clear that yesterday the Prime Minister called a consultative meeting with all the Uganda Manufacturing Association, and among all the people who have the potential to produce, to manufacture the face mask, they are able to produce a total of 800,000 face masks per day. And that will translate to about 11.2 million face masks in 2 weeks, which certainly is not adequate. And the question came, how are we going to cover the population of this country? What we have discussed and what I'd already put here is that we are zoning the country in such a way that once the face mask, the first phase, distribution starts as others are made to distribute the other parts of the country. So the country is going to be zoned and it's going to be distributed in such a manner. It has got nothing to do with procurement procedure. And Madam Speaker, National Medical Store, Uganda Bureau standards, including National Drug Authority, are part of the stakeholders when it comes to do with issues with drugs, supply, and medicine. So the stakeholders meeting was not a procedure, a meeting called to start procurement procedure. But Madam Speaker, National Medical Store has got all the mandate to procure drugs in this country, medicine, supplies, and all the sundries. What we are talking about this personal protective wear, which falls under the mandate of National Medical Store. So this is the body that is involved in the process of procurement. However, I want to say that all the necessary procedure is being followed, including National Drug Authority being fully involved in the process.